AP Human Geography, Chapter 2, Population and Health.
KC 2.1, Where People Distributed. Understanding carrying capacity. Carrying capacity is the maximum population size of a species that the environment can sustain indefinitely given available resources, food and water. How many people can a planet truly support? As in international demographics shift, it is imperative to grasp how resources, infrastructure, and innovation can impact a region's carrying capacity. Overpopulation can occur when the number of people exceeds the capacity of the environment to support life at a decent standard of living. Each demographic stage presents unique challenges and opportunities for health resources. This information shapes policies and improves quality of life globally. Demography is a scientific study of population characteristics, population concentrations. It can mean the portion of the Earth's surface occupied by the permanent human settlement. As demographic transition progresses, a growing gap is emerging in access to healthcare. How are countries in advanced stages managing an increased healthcare burden? Inequalities in access to medical facilities highlight this challenge. Understanding these dynamics is vital for anticipating future health needs. Population density is correlated with arithmetic density, the total number of people divided by the total land of area, which is also correlated with physiological density, the number of people per unit area of arable land. Arable land is the land suited for agriculture. Agricultural land, the ratio of the number of farmers to amount of arable land. How does concentration of people in a given area shape health services and resources? As nations progress through demographic stages, awareness grows about the stark disparities in access to medical facilities and higher density may correlate with better health outcomes, or it may mask hidden challenges such as a negative health outcome with increased risk of diseases. KSU 2.2, why is population increasing? The first thing I'm going to be talking about is about epidemiologic futures. Understanding how global demographic shifts reshape health access is crucial. As countries navigate through various demographic stages, disparities in healthcare resources emerge. What are the implications for public health? This analysis dives into the connection between rapid population changes and evolving healthcare practices, highlighting the urgent need to address these inequities. The second thing is population and resources. As global demographic trends shift, the disparities in health disparities illuminate the underlying challenges within health systems worldwide. With natural increase rates declining, it becomes crucial to recognize the stark differences in healthcare access and quality across various transitional stages. Why does equitable access to healthcare matter? Because it is not just about treatment, it's about fostering healthier communities and ensuring that no one is left behind in this evolving landscape. The third thing is unequal access to resources. As nations evolve, we face a critical question. What impact does unequal access to resources have on overall health outcomes? Are our healthcare systems equipped to adapt to these shifting demands? This pivotal transformation underscores an urgent call to action to bridge existing gaps in healthcare services and innovate groundbreaking solutions. Failure to address these disparities could jeopardize the well-being of vulnerable population. The fourth thing is unpacking stage five, the reality of poverty. Is poverty simply a number or a profound crisis impacting countless lives? In this pivotal stage of demographic evolution, the distribution of resources becomes significant. Limited access to healthcare and quality education perpetuates a relentless cycle of poverty. The last thing is potential drivers for advancing to stage five, enhanced connectivity. In today's global landscape, how to increase connectivity and interactions redefine our understanding of demographic stages. With nations advancing through the demographic transition, the disparity in health resources become increasingly apparent.
Vocabulary. Natural increase rate is the percentage of growth of a population in a year computed as accrued birth rate minus accrued death rate. Doubling time is the number of years needed to double population, assuming a constant rate of natural increase. Accrued birth rate is the total number of live births in a year for every 1,000 people alive in the society. Total fertility rate is the average number of children a woman will have throughout her childbearing years. Infant mortality rate is the total number of deaths in a year among infants under 1 year of age for every 1,000 live births in a society. Crude death rate is the total number of deaths in a year for every dozen people alive in the society. Demographic transition is the process of change in a society's population from a condition of high crude birth and death rates and low rate of natural increase to a condition of low crude birth and death rates. Industrial revolution is a series of improvements in industrial technology that transform the process of manufacturing goods. The medical revolution is medical technology invented in Europe and North America that has diffused to the poor countries in Latin America, Asia, and Africa. Improved medical practices have eliminated many of the traditional causes of death in poor countries and enable more people to live longer and healthier lives. Key issue 2.3: Why does health vary by region? As the world natural increase is slowing down and more countries are moving to stage 3 or 4 of the demographic transition, it is becoming more and more noticeable to geographers that difference in health resources in many countries are at different stages of the demographic transition. A country's development is highly reflected on their medical services/facilities and healthcare. Developed countries have more healthcare resources than most developing countries. Healthcare is mostly a public service available at little or no cost since they spend more/a higher percentage of their wealth on healthcare. Annual per capita expenditure on healthcare exceeds 1,000. The United States is the only developed country that requires individuals to pay an average of 55% on healthcare. Hard pressed to maintain the levels of public assistance, economic growth has increasingly causing governments to have to face a choice between reducing benefits and increasing taxes to pay them. Developing countries less advanced resources than most developed countries, and individuals must pay more than half the cost of healthcare. In some poor countries, threats to health and sustainability are not so much as financial as environmental. Health and gender/mortality risk. Maternal mortality rate is the annual number of female deaths per 100,000 live births from any cause related to or aggravated by pregnancy. Health and gender. During childbirth, both the mother and baby girls may be at risk since females face health risks that profoundly affect the size and composition of the population of countries and as a whole. Mothers at risk. The world has made progress even though its maternal mortality rate was 216 in 2015. The most common causes of maternal death in poor countries are heavy bleeding and high blood pressure. Developed countries have many resources to help limit these incidences. The United States maternal mortality rate 14 is the highest of developed countries, 1 out of 12, and the only developed one where rate has increased since 1990. Due to the difficulties of low-income people in getting access to healthcare, many women are 4 times more likely to die of a pregnancy-related complication. Baby girls are at risk. Sex ratio is the number of males per 100 females in the population. Over the past decades, there has been a national trend of female babies going missing, estimated 170 million due to abortion, sometimes irregulated them getting killed in infancy, or there being no report to censors or health officials. The sex ratio informs us about this issue. It is usually 100 to 105, but it is 114 to 100 in China and 112 to 100 in India, which is much too low to be random. The root cause is gender inequality based on cultural preferences and government policies of smaller families. Sometimes parents may hide their baby girls in a rural area and provide them with less food and healthcare. This causes many adult males to be unable to find women to marry. Have an aging/caring for older people. Life expectancy is the average number of years an individual can be expected to live. Given current social, economic, and medical conditions, life expectancy at birth is the average number of years a newborn infant can be expected to live. Potential support ratio is the number of working age people ages 15 to 64 divided by the number of persons 65 and older. Have an aging. A country's stage of demographic transition determines the percentage of people in different age groups, which helps to explain a country's distinct health challenges. Caring for older people. People on average live much longer in wealthier countries as countries progress through the demographic transition, the more retired older people who need adequate levels of income and medical care. The gain of the population places on governments in developed countries to meet those needs. The world's potential support ratio is currently around 9 working age to 1 elderly and is expected to decline to 4 to 1. As the ratio gets smaller, fewer workers are available to support the retired elderly. Caring for younger people/comparing young and old. Developing stage 2 countries, due to higher CBR, TFR, and life expectancy, have more young people than stage 4 countries. Under age 15 worldwide, 26%, developed countries 16%, and developing countries 28%. Comparing young and old. A population pyramid is a bar graph that displays the percentage of a place's population for each age and gender. One with a broad range indicates a high percentage of young people, and one with the highest levels of whiter on the side indicate a gender living longer than the other. Large percentage of children in poor countries strains their ability to provide needed services. The dependency ratio is the number of people who are too young, 15 or less, or too old, 65 or more, to work compared to the number of people in their productive years. The longer the dependency ratio, the greater the financial burden on them to support the unemployed. Epidemiology transition slash stage 1 and 2. Epidemiology is a branch of medical science concerned with the incidence, distribution, and control of diseases that are prevalent among the population at a particular time and are produced by some special, not generally present in the affected place. The epidemiological transition focuses on understanding how challenges threats in each stage of the demographic transition. Measures to control and derive an epidemic derive from understanding its distinctive distribution and method of diffusion. Epidemic is a widespread occurrence of an infectious disease at a particular time. A pandemic is an epidemic that occurs over a wide geographic area and affects a very high proportion of the population at the same time. Stage 1 pestilence and famine. Epidemics and pandemics, along with accidents and attacks by animals and other humans, were principal causes of human deaths. Humans' most violent stage 1 pandemic was the Black Plague. Stage 2 routine pandemics. The stage of routine pandemics such as cholera because improved sanitation, nutrition, and medicine during the Industrial Revolution reduced the spread of infectious diseases. Epidemiology transitions like stage 3 and 4. Stage 3 degenerative diseases, characterized by decreasing death from infectious diseases and increasing chronic disorders such as cardiovascular diseases, heart attacks, and cancer associated with aging. The global pattern of cancer is the opposite of that for stage 2 countries. Stage 4 delayed degenerative and lifestyle diseases, contains cardiovascular diseases and cancer that linger, but the life expectancy of older people is extended through medical advances. Better diet, reduced use of tobacco or alcohol, and more exercise has improved health. Death rates increase through use of prescription and illegal drugs, especially opioid consumption of nutritious food and sedentary behavior. Issue 2.4 Why may population change in the future? As the pace of the demographic transition slows down, what impact does this have on the distribution of healthcare resources? Let's explore the challenges and opportunities for countries at different stages of this crucial process. How must policies and infrastructure evolve to meet constantly changing healthcare needs? Exploring the impact of pronatalist and antinatalist policies. How do these policies shape population growth and demographic trends? Pronatalist policies are government policies that support higher birth rates through incentives, while antinatalist policies support lower birth rates and aim to curb population growth due to limited resources. Many countries, especially China and India, have population problems so they normally resort to these policies. With varying approaches across countries, the effectiveness of these policies raises crucial questions about sustainability and the future of global health resources. Family futures. The CBR has declined rapidly since 1990 from 27 to 20 worldwide and from 31 to 21 in developing countries. Two strategies have been successful in reducing birth rates. Lowering CBR through education and healthcare emphasizes the importance of improving local economic conditions. However, a community has more money to spend on education and health programs that promote lower birth rates for women to understand to make good decisions, playing a key role in the overall quality of life for families. Lowering CBR through contraception. Even though economic development may promote lower birth rates in the long run, the world, especially developing countries, cannot wait around and resort to cheap contraceptives. Allocating resources into family planning programs can be fast help. Its rapid growth in developing countries is evidence of modern rapid diffusion, even to places with limited access to education and modern communications. Many oppose birth control programs for religious opinion and political reasons, which causes a big divide. Epidemiologic features. In the possible stage 5 of the demographic transition, the CDR rises because of more elderly. It is said that the world is moving to the stage of the epidemiologic transition. New infectious diseases have risen due to this. Reason for possible stage 5 evolution. Many infectious diseases have evolved into becoming resistant to drugs and insecticides. For malaria, they were nearly eradicated in the mid-20th century by spraying DDT for mosquitoes that carried the parasite. Malaria now causes around 500,000 deaths worldwide annually. Reason for possible stage 5 poverty. Infectious diseases are more powerful in poor areas because of their unsanitary conditions and expensive drugs needed for treatment. Tuberculosis is an infectious disease that has been largely controlled in developed countries but continues to kill people in developing countries. Reason for possible stage 5 increased connections. Pandemics have been spread in recent decades through the process of relocation diffusion. As the people carrying diseases travel, people are exposed to them, which causes worldwide pandemics to occur. The most lethal epidemic in recent years has been AIDS. Worldwide, 35 million people have died, and 37 million were living with HIV by 2017. Population and resources. The world's rate of population increase is far running the development of food supplies. Because population increased geometrically, population doubled, whereas food supply increased arithmetically wouldn't be enough to feed the world. All of this came from Thomas Malthus's theories. Worldwide carrying capacity in terms of food production has increased in the past half century somewhat more rapidly than Malthus predicted. In India, for example, rice production has followed Malthus's expectations fairly closely, but wheat production has increased twice as fast as Malthus expected. On the population side, Malthus has been less accurate. His model expected population to quadruple during half century. Even in India, with relatively rapid growth, population has increased more slowly than that and the country's food supply. This was Chapter 2, Population and Health, explaining where people distributed, why is population increasing, why does health vary by region, and why might population change in the future. Brought to you by Kate Corchado, Christopher Medina Chavez, and Diana Thomas. Hope this was helpful. Have a good test review.